You might be doing a lot of therapies, and to yourself, they might all look the same or be the same. I don't know how many times I get patients who are saying, "Oh, I've done that therapy before. Oh, I've tried that before." And you start doing the therapy or you ask them some questions on it, and you're like, "Well, sadly, the therapy you were doing wasn't the same as the therapy I'm doing." Even though they look the same, there's a lot of little differences that can mean huge and make huge impacts with the patients themselves. So when we're looking at vision therapy itself, is your eye moving from a central position outwards? Is it moving from the left to the right to the left? Is it moving in a diagonal plane? Are you looking at small targets? Are you looking at big targets? Are those targets spaced closely together? Are those targets spaced widely apart? Are we moving your head when you are moving or you're doing a certain type of eye movement? Is your head nice and stationary? Do we play with the backgrounds? Are the depths changing? Are the depths nice and clear and uncontaminated? All those little details, all of them, they're really important when it comes to head injuries. So knowing kind of the specificities between why you might use one compared to another can make an extremely big difference between what kind of therapies you're doing and how effective they will be at rehabbing you in your head. So when it comes to you as the patient, it might look like you're doing similar therapies, but a lot of the finer details make huge differences. So just something as simple as vision therapy, there's so many different aspects that need to be thought about in terms of what we're working with and how it will impact your head. So when you go do vision therapy with one practitioner to another, just keep in mind that even though you've done, let's say, vision therapy with one person, it does not mean that it will look the same with another practitioner. Again, the sweeter details come from where that person's background is and how they've been trained to assess you and how they've been trained to treat you.